Essentials of Pharmacology for Health Professions, 9th edition, Chapter 24, Reproductive System Drugs. Chapter Objectives. Upon completion of this chapter, you should be able to identify the uses, side effects, and precautions for the androgens, list the uses, side effects, and precautions or contraindications for the estrogens and progestins, describe the various types of contraceptives and how they are similar and different, describe the use of oxytocics and the precautions to be observed, explain the uses of terbutaline, prostaglandins, and magnesium sulfate, explain drug therapy for erectile dysfunction, and describe other gonadotropic drugs. Reproductive system drugs. Hormones that regulate the functions of the reproductive systems include endogenous chemical substances, which originate within different areas of the body. There are four main reproductive hormone categories. They include the gonadotropic, androgens, estrogens, and progestins. The gonadotropic hormones include the follicle-stimulating hormone, or FSH, and these stimulate the development of ovarian follicles in the female and sperm production in the testes of the male. The luteinizing hormone, which works in conjunction with FSH to induce secretion of estrogen, ovulation, and development of the corpus luteum. The luteotropic hormone, which stimulates the secretion of progesterone by the corpus luteum and secretion of milk by the mammary gland. Androgens are male sex hormones secreted mainly in the interstitial tissue of the testes in the male and secondarily in the adrenal glands of both sexes. Androgens stimulate the development of male characteristics, masculinization, and include testosterone and androsterone. They are used for replacement in cases of diminished testicular hormone with testosterone, congenital hypogonadism or delayed puberty in the male, acquired hypogonadism such as orchitis, trauma, tumor, radiation, surgery of the testicles, or drug-induced, palliative treatment of females with advanced metastatic carcinoma of the breast. An example of that would be methyl testosterone. It's given PO or by mouth, and the dose will vary. It's also used for treatment of endometriosis and fibrocystic breast disease, and treatment of cachexia with oxandrolone, an anabolic steroid with much greater anabolic effects than androgenic effects, thus promoting weight gain in patients with burns, trauma, AIDS, or chronic obstructive pulmonary disease. There are several side effects of androgens, and they are discussed on this slide. And just to include a few: edema, hypertension, acne, oligospermia, gynecomastia in males, jaundice, hepatitis, premature closure of bone ends in adolescents with stunting of growth, and increased low-density lipoproteins, decreased high-density lipoproteins, and insulin resistance. There are a few others listed here as well. Some precautions of androgens include cardiac, renal, and liver dysfunction. Edema is common. Men suspected of having carcinoma of the prostate or breast stimulates growth of cancerous tissue. Geriatric males, they may increase the risk of or worsen prostatic hypertrophy and carcinoma or sexual overstimulation. Prepubertal males who have not reached their full growth potential, it may stunt growth by premature closure of bone ends. And diabetes, obesity, or dyslipidemia, which is abnormal lipid profile. This slide provides very important patient education for patients on androgen therapy. You want to instruct your patients taking only prescribed drugs according to the directions. Skin irritation is possible with transdermal formulations. Definitely want to make sure that they report side effects, especially edema, jaundice, nausea, or vomiting. Reporting sexual effects for males such as decreased ejaculatory volume and excessive sexual stimulation, especially in geriatric patients beyond cardiovascular capacity. Sexual effects for females to expect is hirsutism and voice deepening. Possibility of stunted growth when administered to adolescent boys before puberty, and to avoid secondary exposure of children and partners. Adults who use testosterone gels should target a discrete application site like the front and inner thighs or underarms, depending on the product used. Wash their hands with soap and warm water after every application, and cover the application site with clothing once the gel has dried. Knowledge check activity 24-1, which is not one of the four main reproductive hormone categories. Is it A, gonadotropic, B, androgens, C, oxytocin, or D, estrogen? Write your answer down and the answers will be revealed at the end of the video. Erectile dysfunction is the inability to achieve or maintain an erection sufficient for satisfactory performance. Erectile dysfunction increases with age, with an increased risk in those with diabetes, cancer, stroke, and cardiovascular disease. The treatment plan for erectile dysfunction, or impotence, includes the use of phosphodiesterase inhibitors, which is thought to impair the production of nitric oxide. Phosphodiesterase inhibitors examples are sildenafil or Viagra. This was first approved to treat ED, and it was followed by Levitra, Cialis, and Stendra. Phosphodiesterase is found in various organs and tissues such as the prostate, pulmonary arteries, other blood vessels, the retina, heart, liver, and brain. Sildenafil as Rivado and tadalafil as Adgara are also approved to treat pulmonary hypertension. Tadalafil as Cialis is also approved for the treatment of signs and symptoms of benign prostatic hyperplasia, or BPH. This slide discusses side effects, contraindications, and interactions with ED medications. Side effects include headache, flushing, vision abnormalities and dizziness, hearing loss and tinnitus, dyspepsia, nasal congestion, rhinitis, diarrhea, rash, and back pain. Cardiovascular events including angina, syncope, tachycardia, palpitation, and hypotension. And erection for more than 4 hours requires immediate treatment by a physician. Contraindications include nitrates or alpha blockers. This potentiates the hypotensive effects if used concurrently. Older adults and patients with pre-existing cardiovascular risk factors, and hepatic or renal function impairment. Interactions with nitrates, antiarrhythmics, antiretroviral protease inhibitors, macrolides, quinolones, and some antifungals. They potentiate prolonged hypotensive effects. And grapefruit juice. Use with caution as they may potentiate hypotensive effects. Knowledge check activity 24-2. Which side effect requires immediate treatment by a physician? Is it A, tinnitus, B, erection for more than 4 hours, C, nasal congestion, or D, back pain? Write your answer down and you can check it at the end of the video. Estrogens are the female sex hormones that are produced mainly by the ovaries and secondarily by the adrenal glands. Uses of estrogens include contraceptives combined with progestin. These combination products are also used to treat menstrual irregularities and dysmenorrhea, which is painful menstruation. Menopausal vasomotor symptom relief. Female hypogonadism owing to ovarian pathology or oophorectomy, which is ovary removal. Postmenopausal prevention of osteoporosis, secondary to estrogen deficiency, only if unable to take other agents and if benefits outweigh the risk. Atrophic vaginitis from decreased secretions, low-dose vaginal cream biweekly. Postcoital use after unprotected sexual intercourse within 72 hours of a single large dose to prevent, not terminate pregnancy. And palliative treatment for males with advanced inoperable prostate cancer. There are several side effects of estrogens, and they include increased risk of thromboembolic disorders, hypertension, myocardial infarction, and stroke. Skin discolorations, acne may decrease or occasionally increase. Fluid retention and edema, increased serum triglyceride levels. Folic acid deficiency may require folic acid supplements. Liver function abnormalities, including jaundice, anorexia, and pruritus. Breakthrough or irregular vaginal bleeding. Increased risk of cervical erosion and candida vaginitis. Headache, especially migraine and depression. Visual disturbances, breast tenderness, enlargement and secretion. Increased risk of gallbladder disease and cancer of the uterus with estrogen alone. Therefore, progesterone is recommended with estrogen. Precautions of estrogens include hypertension, thromboembolic disorders, deep vein thrombosis and pulmonary embolism, stroke, and myocardial infarction, liver dysfunction, breast cancer, except for palliative treatment, undiagnosed vaginal bleeding, visual disturbances, severe headaches and migraine, shortness of breath and chest or calf pain, pregnancy, increased risk of endometrial cancer from prolonged continued high-dose estrogens, pregnancy, serious fatal toxicity and vaginal or cervical cancer for the offspring later in life, lactation, and diabetics with heavy smokers. The image on this slide represents how menopause can present with various symptoms throughout the body and can change as menopause progresses. Menopause is a normal, natural life event for women as part of the aging process. During menopause, levels of estrogen and progesterone are reduced, leading to the development of hot flashes and night sweats and atrophic vaginitis. As you can see, symptoms of menopause include hair loss, itchy skin, hot flashes, skin dryness, night sweats, breast pain, loss of libido, vaginal dryness, menstrual periods that occur less often and eventually stop, joint pain, osteoporosis, irregular heartbeat, digestive problems, frequent urination and urinary pain, and brittle nails. Also include fatigue, dizziness, irritability, headaches, depression, weight gain, mood swings, sleep disorders, and memory lapses. Menopause can be managed by estrogen therapy, estrogen and progestin therapy, and hormone therapies. We'll discuss that in the next slide. Estrogen therapy, or ET, when estrogen alone has been associated with an increased risk of endometrial carcinoma in women with an intact uterus. When combined with progestin, risk of endometrial cancer is substantially reduced. There were studies conducted by the Women's Health Initiative, and they were used to determine the exact degree to which hormone therapies presumably protected the heart and to investigate the degree to which some of the known and potential risk of hormone therapies, such as breast cancer and blood clots, canceled out any benefits. The WHI also explored whether hormone therapies prevented fractures, colon cancer, and dementia, including Alzheimer's disease. It was announced that the risk of combined hormone therapy not only outweighed its benefits when used to prevent certain diseases, but the combined hormone therapy could increase the risk of certain conditions it was previously believed to prevent, such as heart attack. These findings led to further research, and the North American Menopause Society's new statement on hormone therapy, which was published in 2012. I'll discuss the guidelines, most recent guidelines, on the next slide. Hormone therapy's most recent guidelines for use includes remains the most effective treatment available for menopausal symptoms, including hot flashes and night sweats. It may not be in the best interest to take hormone therapy for those that have had blood clots, heart disease, stroke, or breast cancer. Length of time to take hormone therapy is different for EPT and ET. For EPT, time is limited by the increased risk of breast cancer seen with more than 3 to 5 years of use. For ET, no sign of an increased risk of breast cancer was seen during an average of 7 years of treatment. Most healthy women below age 60 will have no increase in the risk of heart disease with hormone therapy. And ET delivered through the skin, such as transdermal method, patches, cream, gel, or sprays, and low-dose oral estrogen may have lower risk of blood clots and stroke than standard doses of oral estrogen, but all evidence is not yet available. Research continues to bring women valuable information to help with their decisions about hormone therapy. Progestins. Progesterone is a hormone secreted by the corpus luteum and adrenal glands. It's responsible for changes in the uterine endometrium in the second half of the menstrual cycle in preparation for implantation of the fertilized ovum, development of the placenta after implantation, and development of mammary glands. Progestins are synthetic drugs that exert progesterone-like activity. They are used for treatment of amenorrhea and abnormal uterine bleeding caused by hormonal imbalance, contraception, either combined with estrogen or used alone, postmenopausal, sometimes combined with estrogen and replacement cyclical therapy, adjunctive and palliative therapy for advanced and metastatic endometrial or breast cancer, and management of paraphilia, which is sexual deviancy, especially pedophilia and sexual sadism. There are several side effects of progestins, and they include, to name a few, menstrual irregularity and amenorrhea, breakthrough bleeding and spotting, edema, weight gain, breast tenderness, enlargement and secretion, mental depression, thromboembolic disorders, possible decrease in bone density with prolonged use. There are several others as listed. Precautions of progestins include any condition that might be aggravated by fluid retention, such as asthma, seizures, migraine, cardiac or renal dysfunction, history of mental depression, history of thromboembolic disorders, especially with tobacco smoking, history of cerebrovascular accident, liver disorders, undiagnosed vaginal bleeding, pregnancy, breast, cervical, uterine, and vaginal cancers, except for palliative treatment. This slide provides valuable information for patient education for those taking androgen therapies. Now let's check Activity 24.3, which is not a symptom of menopause. Is it A, hair loss, B, breast pain, C, digestive problems, or D, stable moods? Write your answer down and you can check it at the end of the video. The following chart shows the various types of contraceptions and how they are administered. The contraceptive method, estrogen progestin contraceptive, and this includes monophasic, biphasic, and triphasic. And these are, depending on the estrogen content, is how they are classed. But note, the biphasic and triphasic formulations are intended to deliver the hormones similar to physiological processes. They are administered by oral tablet or transdermal patch. Considerations for treatment with these include choice of estrogen. Progestin is based on patient's history, hormone-related side effects, prior use, and desired effect. Whenever possible, you want to start on the monophasic regimen with the smallest dose of estrogen, 20 micrograms for most women, and progestin that is compatible with a low failure rate and meets the individual needs of the woman. For the progestin-only contraceptive, it's administered oral tablet, injection, or intrauterine device, or IUD. It's recommended for patients who do not tolerate estrogen or in whom it is contraindicated. Another contraceptive medication is the progestin-containing IUD. It's administered IUD. There are many considerations, precautions, or contraindications and side effects that must be addressed when considering the IUD as a method of contraception, in which the physician will assess each patient and the proper contraceptive treatment plan. Next medication is postcoital contraception. Some examples is low overall or seasonal. The dose varies. Next choice, this is available over the counter for 17 years and older. Prescription only for those less than 16 years old. Plan B, one step. This is given PO or by mouth, one tab, single dose, and is now available over the counter with no age restrictions. In Ella, this is only with prescription. It's administered with an oral tablet. Considerations: it should not be used as a regular form of birth control and is only taken when women are exposed to the unintentional risk of pregnancy. Postcoital contraception must be administered within 72 hours of unprotected intercourse and is more effective the sooner it is taken after having unprotected sex. Some cautions for estrogen products include thrombophlebitis, history of cerebrovascular accident, history of chest pain or myocardial infarction, known or suspected history of breast cancer or other estrogen-dependent malignancy, or pre-existing cervical cancer, pregnancy, major surgery, history of liver disease, or impaired liver function. This slide provides some very valuable patient education for those on oral contraceptives. You want to instruct your patients using backup contraception for the first month on oral contraceptives and for the first 2 weeks with Depo-Provera. Taking the contraceptive at the same time every day. The general instruction is that the pill should be doubled up until the patient has caught up, using a backup method until the period begins. If 3 or more pills are missed, discontinue and restart at next period with new pack. Should stop oral contraceptives if pregnancy is suspected and stop smoking. Using backup contraception when taking other medicines that may alter effectiveness. See the interactions. Reporting the following symptoms to the healthcare professional should they occur while on oral contraceptives: chest pain, shortness of breath, severe headache, dizziness, weakness, numbness, eye problems, breast lumps, or severe leg pains in the calf or thigh. And the fact that oral contraceptives do not protect against HIV, AIDS, or other sexually transmitted infections. Knowledge Check Activity 24-4. Which contraceptive is only available to be administered through an IUD? Is it A, estrogen progestin, B, progestin only, C, progestin containing IUD, or D, postcoital contraception? Write your answer down and you can check it at the end of the video. Case study. A 14-year-old patient is brought to the emergency room after being sexually assaulted. The patient stated that she is unaware if there was sexual intercourse due to blacking out and not remembering anything. The physician gains approval from the patient's mother to perform rape kit testing and speaks to the mother about possible pregnancy. The mother wishes to take precaution to ensure this attack did not induce pregnancy. What line of birth control will the physician prescribe for the patient? Is it A, postcoital contraception, B, progestin containing IUD, C, progestin only contraception, or D, estrogen progestin contraception? From what we've learned so far, think about this and choose the best answer. You can check your answer on the next slide. If you chose A, postcoital contraception, you are correct. This is the best answer for this case study. Oxytoxics. Oxytoxic agents are used to induce labor. Oxytocin is a hormone secreted by the posterior pituitary lobe. This hormone stimulates the uterus to contract, thus inducing childbirth. The goal of labor induction at term is to facilitate the vaginal delivery of a healthy infant. Oxytocin is given IV infusion of dilute solution slowly and at a carefully monitored rate. It's used for inducing labor with at-term or near-term pregnancies associated with hypertension, such as with, in other words, eclampsia, or cardiovascular or renal disease, maternal diabetes, or uterine fetal death at term. Stimulating uterine contractions during the first or second stages of labor if labor is prolonged or if dysfunctional uterine inertia occurs. Side effects include tetanic contractions with a risk of uterine rupture, cervical lacerations, abruptio placenta, impaired uterine blood flow, amniotic fluid embolism, fetal trauma including intracranial hemorrhage or brain damage, fetal cardiac arrhythmias, including bradycardia, tachycardia, and premature ventricular contractions, and fetal death because of asphyxia. With large amounts of oxytocin, you want to watch for severe hypotension, tachycardia and arrhythmias, postpartum hemorrhage, subarachnoid hemorrhage, and hypertensive episodes. Contraindications with oxytocin include elective induction of labor merely for physician or patient convenience, which is not a valid indication for oxytocin use. Cephalopelvic disproportion and unfavorable fetal position or presentation, uterine or cervical scarring from major cervical or uterine surgery, fetal distress when delivery is not imminent, placenta previa, prolapse cord and multiparida, and prolonged use with eclampsia. Knowledge check activity 24-5. Which are contraindications for oxytocin? Mark all that apply. A. Elective induction of labor for convenience. B. Fetal distress when delivery is not imminent. C. Prolonged use with eclampsia. Or D. Uterine or cervical scarring. Write your answer down and you can check it at the end of the video. Prostaglandins is another oxytoxic. It's an agent that is released as a natural part of the cervical ripening process. Therapeutic abortion in the second trimester, treatment of postpartum bleeding because of uterine atony that is unresponsive to conventional management, including oxytocin IV, uterine massage, uterine manipulation, and injectable ergo preparations. Side effects: GI hypermotility, including nausea, vomiting, and diarrhea, decreased by premedication with antiemetics and antidiarrheal agents. Bradycardia, hypotension, hypertension, and arrhythmias, dizziness, syncope, flushing, and fever, bronchospasm, including wheezing, dyspnea, chest constriction, and chest pain. Cervical laceration or uterine rupture, which is less common, and retained placenta, which is less common. Contraindications: used only by trained physicians in a hospital where intensive care and surgical facilities are available. Is contraindicated with a history of pelvic surgery, uterine fibroids, cervical stenosis, and acute pelvic inflammatory disease. Caution with asthma, hypertension, and cardiovascular or renal disease, and previous history of cesarean section. Mifepristone, or RU-486, is an anti-progesterone drug used to terminate an unwanted pregnancy, in conjunction with misoprostol within 49 days from the beginning of a woman's last menstrual period. Mifepristone blocks the action of progesterone, a hormone essential for maintaining pregnancy. It's used only very early in pregnancy. Without progesterone, the uterine lining thins, so the embryo cannot remain implanted and grow. This would require 3 visits to a qualified physician to complete the treatment. At the first visit, the doctor will determine the gestational status. The woman qualifies for the procedure. She must sign an informed consent. The second step requires the woman to swallow a second drug 2 days later to fully detach the embryo from the uterus and expel it. This will cause uterine contractions with miscarriage like cramping and bleeding. And the third step requires a follow-up visit within 2 weeks to make sure the abortion is complete. In case of a hemorrhage, it might be necessary to consult the physician sooner. Studies have shown that mifepristone is 77 to 92% effective in terminating pregnancy. Some cases, a curettage of the uterine cavity is required to remove any remaining products of conception. Side effects with this is nausea, diarrhea, uterine hemorrhage in about 5% of patients, infection if the embryo is not completely expelled, a malformed child if the second and third steps are not completed. Contraindications include ectopic pregnancy, anytime after 49 days from the beginning of a woman's last menstrual period, current long-term corticosteroid therapy, bleeding disorders, and current anticoagulant therapy. Methyllergonivine, this is a semisynthetic ergoalkaloid It's used for the prevention and treatment of postpartum and post-abortion hemorrhage. Side effects: nausea, vomiting, dizziness, headache, diaphoresis, palpitation, dyspnea, and arrhythmias. Hypertension, which is more common, or hypotension. Numbness and coldness of extremities with overdose. Peripheral vasoconstriction. Seizures with overdose. Contraindications: when administered during the third stage of labor, it may lead to retained placenta. It's contraindicated with cardiovascular disease, especially hypertension, and with hepatic and renal impairment. It's also contraindicated in patients with preeclampsia or eclampsia. The last two oxytoxic medications are terbutaline and magnesium sulfate. Terbutaline is used with careful monitoring in the management of preterm labor. Side effects include maternal nervousness, tremors, increased heart rate, headache, nausea, vomiting, hypotension, heart palpitations, cardiac arrhythmias, myocardial ischemia, and metabolic abnormalities, hyperglycemia and hypokalemia. Fetal tachycardia, hypotension, hyperbilirubinemia, hypoglycemia, hypocalcemia, and intraventricular hemorrhage. Contraindications: watching the patient closely for signs of pulmonary edema. Should not be used in patients with hypertension, cardiac disease, hyperthyroidism, diabetes, or history of seizures. Prolonged toxicolysis used beyond 48 to 72 hours. For terbutaline, administered by injection or by a continuous infusion pump because of the potential for serious maternal cardiovascular events and death. Magnesium sulfate is used for patients with severe preeclampsia or eclampsia to control elevated blood pressure and prevention and control of seizures. Side effects: flaccid paralysis and central nervous system depression, circulatory collapse, cardiac depression and cardiac arrest, pulmonary edema and fatal respiratory paralysis, flushing, sweating, and hypotension. Fetal toxicity at high doses is rare with proper use and monitoring, and the antidote for overdose of magnesium sulfate is respiratory depression or heart block is IV administration of calcium glutamate. Contraindications include impaired renal function, heart block or myocardial damage, and prolonged use because of potential respiratory depression in the neonate. Knowledge Check Activity 24-6. Which are contraindications for magnesium sulfate in adults? Mark all that apply. A. Previous history of cesarean section. B. Impaired renal function. C. Respiratory depression. Or D. Heart blockage. Choose the answer, write it down, and you can check it at the end of the video. Gonadotropic drugs. Gonadotropin-releasing hormones act in the pituitary gland to suppress ovarian and testicular hormone production and inhibit estrogen and androgen synthesis. The GnRH analogs inhibit ovulation and stop menstruation, which is similar to what occurs in menopause, thereby providing pain relief and a reduction in endometriotic lesions. Two of these agents are leuprolide and Cineril. Leuprolide is used as an anti-neoplastic agent to inhibit the growth of hormone-dependent tumors, to reduce the size of the prostate and inhibit prostatic tumor growth. It's used for mastectomy, radiation for breast cancer, and management of endometriosis, which is a condition where endometrial tissue develops outside the uterus, causing pelvic or lower back pain. Cineril is also used in the management of endometriosis. Side effects for these include hot flashes and diaphoresis, vaginal dryness and vaginitis, headache and insomnia, emotional or mood swings and reduced libido, weight gain or loss and peripheral edema, nasal congestion or irritation with Cineril, and acne. Contraindications: not to be considered effective as a contraceptive. The patient should use a backup barrier method. Pregnancy or lactation, diabetes, you want to monitor the blood glucose level carefully, and prolonged use creates a hypoestrogenic state that may lead to an increased risk of loss of bone density. Knowledge check activity 24/7. Which is not a side effect of leuprolide and Cinerol? Is it A, hot flashes, B, weight gain or loss, C, increased libido, or D, mood swings? Write your answer down and you can check it at the end of the video. This slide includes the knowledge check activity answers for chapter 24, 1 through 4. This slide includes knowledge check activity answers for chapter 24, questions 5 through 7. Use the following questions to assess yourself and see what you've learned from this chapter. Question 1. What are the uses of androgens? 2. What is the difference between estrogens and progestins? And 3. What are the side effects of oxytocin? You may have to review the video to get the answers to the questions. This concludes Chapter 24, Reproductive System Drugs.